my father's life, I said, with a different protocol. I said, will you manage it? He accepted. Today, because of this protocol, my father has regained his strength. He's able to breathe, walk. He no longer has lesions and all over the place. His skin cancer is virtually been dealt with all holistically through lots of modalities, but mostly because of these products. They have stabilized him. He's 87 years old, and with God's grace, we'll have him for many more years. But he has regained who he was when he was diminishing, and he was not having the quality of life. Now I see that he has a quality of life that will be able to sustain him until the good Lord takes him.
I absolutely love that. I was getting chills, especially when you found the cardiologist that would be there with you in doing the tests and the assessments, but not pushing those pharmaceuticals. And then he himself was able to see how the nutrition actually worked.
Well, I'm on him all the time. I really like him. I really, truly respect him because he's like for the end of care, but we're doing it under the guides because, as they know, they can lose, given the Hippocratic Oath, they can lose their license if they do that. And I sort of challenged him. I said, you were raised with this. I said, why is it that you're not curious? He says, because I can't do about it. They basically can't do anything about it. They basically own me. And I'm like, okay, well, I get that. I'm not sure how you can live with that, but I understand it. And I do respect him. I've also read all of his 70 studies too, because he does all the mechanics, with defibrillators and pacemakers and stuff like that. So I try to honor him by knowing what he's into and then harassing him about what he chooses not to learn.
That's one thing I love about you, Keeley, is you're not afraid to speak your mind, speak your truth.
Well,
and
I've lived long enough to know that if you don't, you're going to die with it. So I'm not dying.
No, but you do it with a finesse.
Oh, thank you.
So, even if it's abrupt, there's still a finesse to it. And I absolutely respect that. Now, folks, as you're listening, I hope you're understanding the value of nutrition. You may be going down that road where you have been under the guidance, under the watchful eye of a doctor. But are you getting where you want to be? Are you hearing this message because maybe, just maybe, the pharmaceuticals that you've been on and continue to have to take more and more may not be the right path for you? Now, this program is for educational purposes only. It's not meant to take the place of your primary care physician, nor are the products meant to treat, diagnose, or cure any disease. But folks, through the science of epigenetics, we have learned that the transfer of disease is not because of genetics. It's because of what we're putting in our body or what our body is not absorbing and not getting. Chemicals are not what we're deficient of. So we encourage you to really look into the importance of the 90 essential nutrients. As Dr. Joel Wallach, who is the founder of our crusade, has put together through his decades of research, published in 26 books, 25 available for purchase, which you can find on his website at drjwallach.com. The other one is held as a national treasure in the Smithsonian Museum. So when you're looking at somebody's pedigree, for lack of a better word, Keeley, and we're looking at Dr. Wallach's, what he's done over his life. You had mentioned something to me that really hit home. Now, you found his cassette you listen to it. When you started listening to Dr. Wallach himself prior to the cassette, or even at the cassette, what is it that really sparked your desire to want to know more?
As he spoke, what he said rang as truth in my spirit. It wasn't just everything that he had been through. It was that tenaciousness about his spirit as a warrior, that he wasn't going to take no for an answer, that he wasn't going to substitute his judgment, his experience, his knowledge, his findings, and he understood and could see what other people couldn't see, that there is an absolute truth to the body being able to do what it does. And what's resonated for me is, how can you improve upon what the creator gave us? It's really, I always question, like when I look at a potential client, now with longevity, it's like, well, do you believe the body has the potential to heal itself? Do you believe you can improve upon it? Because the good Lord gave us everything that we needed. And it really becomes about the difference between belief and doubt and fear. And
Mm-hmm.
I knew that what I was hearing was truth. And I couldn't get enough of it, because it spoke to my rational mind. It spoke to my discernment. It made sense. It wasn't crazy. You don't poison the body to get well. And I just could not buy off on the deception, and could not comprehend, well, in my clinical mind, I know why people choose not to be accountable and responsible. I know why they choose to go to a doctor or a white coat or whatever, because they don't want to be responsible and accountable for the choices and or the effects. But if they also don't take a risk to believe that there's an optimal way to live, that you don't have to suffer, then they'll never know. And what I find out, and what I've been experiencing, obviously through this process of many years, and with people that I meet now, is if you're willing to be responsible and accountable, you're going to take a risk. But if you're not, you're going to go for what you're told.
No, absolutely. And sometimes it's easier just having somebody tell us what to do, whether it's right or wrong.
Well, and I think
But
sometimes
you
too that some
mentioned
of my
something.
clients really just want me to give them a protocol. I won't do it. I refuse to. I said, if that's what you're looking for, I'll turn you off to somebody else. I'm going to educate you, because I want you to be able to advocate on your behalf. I want you to be able to speak truth. I said to that medical, because if you are the change that needs to be in this world. And if you aren't willing to take a risk for yourself based on life and death, I don't know what else would compel you.
And I really appreciate that, wanting to educate them to be their own advocate. Because as you mentioned just a minute ago, you can't poison the body and expect it to get better. Because you're killing
Well, it is
cells.
supposed to be a temple.
That's right. So we were given this temple. We're supposed to take care of this temple, which so many people think, being young, and I was one of them, could eat just about anything, without having ill effect. I mean, I was 128 pounds until I had my fourth child. And then that was another story. But folks, are you hearing what Keeley's saying? Through her own experience, for herself with her father. Now she's taken that and bringing into other clients. Well, even before, she was working with clients that she had met along the way. And you even have some practitioners that you have introduced to longevity that are killing it, in a sense that they're able to help more people. Now, as we're helping, maybe not even help more people, but help people in a different way that actually helps them to get better, rather than just going through the motions. What would you say to that?
Rephrase that question.
So you have introduced people that are already in the modalities of helping others. People are coming to them. You've introduced them to the longevity, to Dr. Wallach's philosophy. They're incorporating that into what they do. How does that make you feel?
At first it was tough because a lot of them are practitioners themselves, meaning they come out of the medical industry, and they would have been in statins for 20 years. And they said, well, I know these aren't good and I've been on them, but I'm not really sure, you know, da, 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 da. And I look at them and I go, okay. So this is sort of where I'm ready and willing to go head to head with them. It's like, okay, I said, ask me any question. I said, I will answer it. I said, until I can get you to understand that you are toxifying your body. You know it. You know what the deficiencies are that particular thing creates, and you're doing it anyway. So once we get over, you know, all of those humps and you watch them get it and take and really understand it, then that's all they want to do, because they recognize, I mean, people are so sick right now. People are so out of life balance in so many ways. And it's like, if you can do anything to give them, help them create a vision of a life worth living that could be optimal in health instead of suffering, then they can choose to live the way they want to live. That to me is the gift that you gave. You know, you and I've sort of talked on several occasions, and I tell you, uh, um, I define Doc as, you know, the modern day Moses. He was basically, you know, given a passion and a drive, and he took it to the mountain. He did all the work. He did the study. Um, he gave everything that he had in order to give it, and he was an obedient servant. He did what he was called to do, living in purpose, on purpose. You know, how could we have the opportunity to do that ourselves? You know, that particular mission was given to him, and we get to come alongside of him, and, you know, through that knowledge, and actually share those truths that can allow somebody to make a decision that will change their life. And
Mm-hmm.
it makes my heart sing.
Absolutely. Yeah. When you hear something and it resonates, sometimes you have to hear it 3 or 4 times. Sometimes it's 40 years apart from the time that you first hear it. I have a lot of people that it's like, you know what, I had that cassette.
Yeah.
And for some reason I held on to it. I had one client that he had to go out and buy a cassette player because he didn't have a cassette player anymore. And he wanted to listen to what was on this cassette. And folks, it's incredible when you have so many dots and then somebody connects those dots for your benefit. I mean, he could have kept this all to himself, but he didn't. And he created this company we call Longevity. And it has put us on a crusade. It has allowed us to be able to learn and then take what we've learned and not just help ourselves, not just keep it to ourselves, but to help others. And that's exactly what Keeley is doing. And Keeley, I mean, you weren't somebody that was just looking for a work from home position. I mean, you're in the corporate world. And this was something that you are doing around that, or as the need comes. Does that sum it up?
Well, I'm transitioning out. I'm transitioning out. I'm doing that work with specific individuals. I can be very choosy. Only the ones that have the integrity where I know where they stand. And most of them I've worked with over, you know, the last 30 years, where they would go from one position to a vice president to a president to a CEO. But now, you know, every place that I've been, every step every course that was taken, I think belief really has led me here, because I was doing, medical advocacy and the legal advocacy, like for somebody who is deaf, out of the court system, or just providing all the research, the system and the process, and making it simple for people. In this particular case, you get to take the benefit of all those skills, all that experience, and put it into here. And one of the most unique things is we have a different form of resistance, and that is belief and unbelief in a totally different way. However, it has to do usually with health and the determination of how one wants to live. It's just a wonderful way of recognizing, turning around and looking back and saying, everywhere I have been got me prepared to do this. So that's really where I want to spend most of my time.
Right. Well, you have been such an inspiration. Every time you share with us, you are giving us a different way of looking at things. I mean, because of your strategic corporate consulting, you look at things a different avenue, many times much deeper than some of us are able to go. But then it makes sense. Just like with Dr. Wallach, he's looking at the nutritional things. And when there's nutrition that's missing and you correct it, the body can do what it's designed to do. You look at it from a different way and helping people understand that what is being offered may not be the best option. And then helping them to understand that there is something different. So, Keeley, you're just fantastic. You're just a brilliant job. You always bring something to the table to help us to look at and consider. And I hope those of you who are on with us really paid attention. What is your calling in life? What are you being called to do? Why are you here? Things don't happen coincidence or by chance. But why are you here? This may be the next step, your transition. So we do have a question. And the question is, what results have your clients gotten since you've become a health coach?
Wow. I have a lot of, I met a lot of individuals who have had some very, very serious health cases. One of them had lupus for 7.5 years, was an international flight attendant, had tendinitis, could not get out of bed, had been to over 25 doctors. And the first time in 7.5 years that she has her life back is in the last 5 months. You didn't see a lot of change within like the first 2 to 3 months. Basically, the thing that is really left is the tendinitis, and we're working on that and changing that protocol. But that's amazing because went to the medical route, went to all of the any modality you can even imagine. I have another one who had nectaretin and fasciitis, and from the basically flesh-eating bacteria, had to make a decision, to take his arm off at the collarbone. With all of the pharmaceuticals that were in his gut, they basically destroyed his gut. So we were rebuilding him over time. He's been with me for a very long time. And I told him, I said, I'm still looking. And I said, I know I found it. I said, it's not even a question. He goes, I don't care what it is, just order it for me. He's lost a ton of weight. He plays pickleball with one arm. He is not disabled in any stretch of the imagination. The only thing he can't do is get ketchup out of a bottle and tie his shoes. He's a pickleball player. He plays golf. He's a pool shark. He is a walking miracle, and he has the life that he has always wanted. His joints are good. His gut is clear. He's able to live, and they can't believe it. People look at him and go, what happened to you? I have another one with non-Hodgkin's lymphoma and leukemia, and he's coming back. The lesions are gone. The doctors are mystified. And then there's some sad stories where some individuals were, they're watching their creatine levels. They were in dialysis, and at the last moment, they basically decided that the white coat threatened him and said, we're not going to cover you and keep doing dialysis if you don't adhere to our protocol, which I'm here in Cleveland, and you can name the medical establishment that would have been. And they failed to the fear, because they were in that doubt and unbelief, and he lost his life, and he was a very important person to me. However, that was his own choice and his will, and there was nothing I could do about it except love him through it. So it's, you can be blessed with the outcome if you're willing to take the risk and really believe that the good Lord had something else in mind for us. He promises, there are all of those promises. The healing is there. He tells us in the good book, it tells us what to eat and when to eat it. It tells us what he's provided and what he hasn't. But you're supposed to be in the world, not of the world. And it's a decision to be made. So I sort of look at this product as that if I want to sustain my life with some level of quality, I said to the best of optimal health, then I have to be willing to be responsible, accountable, and do the research and make a decision to choose life. And that's what the products, from my estimation and my experience, do. They allow people to choose a viable life.
Absolutely. Absolutely a viable life. I've lived it, and I know you've experienced it. And, well, I've got thousands of people that have experienced it, even hundreds of thousands of people.
Yeah.
And
I'm
for
still
some
in process.
reason, it's still a process. It's not instant.
It's a lifelong process.
You didn't get sick overnight. It's not going to be better overnight, but it is amazing how the body can regenerate cells quickly and how people can feel the difference in short order. Some things are tough, absolutely, and it takes consistency. It takes that willing to know that things are getting better. It's faith, believing without seeing. But the nice thing about this is you can feel it. It just takes a little bit longer sometimes. So we have another question. Keeley, would you think being a certified holistic health coach is for everybody?
It could be, depending on, what they want to manifest in their own life. I think that it's a place to begin. If you have had no experience, whatsoever, it will give you the foundational roots of really where you need in order to start. I know people telling me that I'm anal retentive. I actually see that as a compliment. Because I do a deep dive, because I want to know why. If I don't know what and I don't know why, I'm not going to finish until I do. What that course does is it gives you the overview. It starts to get into the depth. It makes it sort of simple, and it gives you a system and a process that you can follow, especially if you don't have any other experience. It can be anybody. It doesn't take, it's simple. Healing is simple. If you can read, if you can evaluate, you can do this.
Absolutely. Now, you've been a business owner in a big world, and you're also a business owner as a certified holistic health coach. What would you say to somebody that has thought about having their own business, and why would being a health coach be something for them to consider?
I think a lot of times it depends if you happen to know why you're here. What it is you want to give, what it is that you want to leave as a legacy. And I've owned businesses where I've been the employee. I've owned businesses where, I usually go in as an external and worked on a 1099. I've done all of that stuff. And this to me is probably, I don't really want to say this because it's going to come back at me. It's one of the easiest things I've ever done. You meet people where they are. You don't try to move them where you want them to be. If you hear them, you see them, they know they're being heard. They know that you can trust you. You answer their questions. You provide them with the science and the data that they want and or they need. Sometimes I bury them on purpose. um, and then they can come back, and you're giving them the gift of evaluation. You're giving them the gift of thought. You're giving them the gift of, courage, and you're empowering them to make choices that maybe otherwise they never would have made. And also the freedom to make those choices to support themselves like they've never been supported before.
So it's pretty gratifying.
Extremely. I've always loved what I've done. My hobby became my career, and I didn't start off to be in business. My clients put me in business. I would go in through another consulting firm, and they'd say, she got Motzi, I want her. And I'm like, excuse me. I mean, I get called into boardrooms, and it's like, okay, what did I do? And they're like, no, you can handle my group. So I need you here. They said, you just have a way of being able to hear me differently, because what happens is the solution's different for everybody. It's not, this is the system and the process, and you're just going to deliver, a one-stop shop. It's really understanding who they are, what they want, and what they need. And whether I did that in the corporate world or whether I do that with whoever that spirit is in front of me, I give them that same gift of intention, that it's uniquely about them and what they need in order to live the life they want to. Because sometimes they don't want the full Monty. They don't want to, they could be very terminally ill, and they either don't have the means, or in a lot of cases they have the means and they just don't want to do it. I'm good with that. I'm not going to change anybody's will. I'm going to help support them wherever they are, and then take them as far as I can, and just say, well, when you need me, find me.
Yeah, that's fantastic. I love that, because we can't force somebody to do something, the one they don't want to do, one they're not willing to do. But if they don't know that there are options, then they're not going to know what they aren't willing to do.
And I think that's important about options, because a lot of people don't know what those options are. And I always say it's options amongst alternatives. It's at least if somebody can lay it out for you, they have the ability to decide whether or not they want to risk that hope, because there is something about, they just don't have that hope that if I'm terminal, can this really happen? Well, what do you have to lose?
Nothing.
But
that's it. When you give the body something that it's starving for in a way that's absorbable, there's not much to lose.
Yeah.
Well, extra weight, pain, discomfort, sickness, illness, the list goes on.
I did a project years ago out in Arizona, and it was one of the best projects I did. I was out there for about 18 months, and there's one of the highest populations of semi-professionals out in Arizona. These people, I was doing a project, and we would open the doors I had to open at 5 o'clock in the morning, because they would work like 5 to 2. This picture of aging, they're up at 5 o'clock with their walking sticks. And then, when you would go to the restaurants in the evening, they would be there. I'm like, don't you people have to go home and go to sleep or something? Because I'm trying to have dinner and this restaurant is packed. It was just the aging, the picture that people have, they have to change it. They have to understand that you can live viable in this house as long as we are intentional about what we do to it. I mean, I've abused my body more than anybody else has, I guarantee you. But the whole point is that now I know. Now I don't have an excuse. And if I choose that excuse, then I'm doing the opposite of what I need to be modeling for myself, my family, my grandchildren, and those that are around me. I want to live a long life. I want 5 lifetimes, before the good Lord takes me off the face of the earth. And the only way that I'm going to be able to do that, to hit that 120, stick to the protocol.
That's right. That's right. Well, folks, what life do you want to choose? It's your choice. Do you want to live and thrive, or do you want to barely survive? Thank you so much, Keeley, for being here with us and sharing from your heart and what you have done through the years, what you're doing now, your way of looking at things, and teaching them, giving them the knowledge so that they can make the decisions themselves.
Well,
That
we all
is,
know that if it wasn't for Dr. Wallach, it's been an absolute privilege and an honor. And it's only just begun.
yes, it's just begun. He's always telling me we've got 400 more years to go. So I said, Doc, you give me 120, let's aim for that. But he's like, but if you shoot higher, I'm like, yes. So if I shoot for
Yeah,
the
that's
moon,
true.
I'll land in the stars. And absolutely, that is what we are doing. So okay, I have a comment here from a
Oh,
beautiful
no.
soul that says, she saved my life through her willingness to meet me where I was.
Oh, wow.
And that is coming from one of her clients, which is just fantastic because I know that she's doing that for others as well. So thank you so much for sharing that. If we could get the co-hosts up, we're actually going to take this day and give God the glory. And thank you, Keeley, and thank him for having you as part of our team, part of our lives, to be able to share with others what we do and the importance it has can make an impact on the lives of others. So I am honored to be able to surround myself with some amazing people. Keeley is one of them. Also on the screen with us, we have Marilyn, who is bringing her skills of being able to do dictation, transcription, putting it into the chat for us. If you're here live with us, you're one that benefits from that. If you're not here live with us, we are Daily with Doc and Becca, Monday through Friday from 12 to 1 p.m. Pacific time by going to zoom.dailywithdoc.com. Again, that's zoom.dailywithdoc.com. So thank you, Marilyn, for all you do. We have my executive production manager who helps to keep us organized and make sure that everything is working properly. And also scheduling our guests and keeping us with a full calendar. That is Ruth Ellen Sanchez. Thank you so much, Ruth Ellen. Folks, tomorrow we have Dr. Judy Reynolds coming back with us, so don't want to miss that. We also have Rod, who's helping to keep an eye on all the different platforms, making sure that things are rolling. So if we have many eyes, it's less work for one person. So thank you, Rod, for being a set of those eyes to help us when something's not quite working right, then the team, the tech crew can get it fixed. Thank you, Rod. And we have Albert joining us from way down in South Africa, helping to let people in. He is our gatekeeper here on Daily with Doc. So thank you so much, Albert, for showing up every day and helping to make sure people get in timely so that they can hear the message live. We have Sherry, who is also part of our tech crew and setting everything up so that it does do the stream. Thank you so much, Sherry. And as you can see, she has multiple certificates behind her. And she found the value in Dr. Wallach's message that helped her help her people even better. So thank you, Sherry, for being part of the team. We have AJ with his hand up. AJ is responsible for helping us get all of the platforms up and rolling. And I did a search, Daily with Doc and Becca, and I was like blown away at all the places that we are reaching and to see the comments on the shows. So folks, wherever you're at, share it with somebody else. Let us know that you're there. We get comments and it'll be, to info@dailywithdoc or questions@dailywithdoc.com, and it just says Rumble, or it just says iHeart, or it just says Instagram, LinkedIn, something radio. I don't even know them all, but we're reaching people and they're hearing the message, and that's what we are here for. So before AJ shares what's on his, no, go ahead and share what's on your mind, AJ.
Well, you know what's on my mind? Today's Cyber Monday, folks. And if you want to be a certified holistic health coach like Keeley and get a certificate like the one on the bottom right behind Sherry, and all of us on this screen are certified holistic health coaches. That's right. And Ruth Ellen's got one over there. And Rod's got his behind him too. So see, all of us are certified holistic health coaches. And for you to become one, today is the last day that you can join at half price. So you can become a certified holistic health coach for as little as around $75 a month for the next 6 months. And if it takes you a year to finish, you'll still have access to all the materials. That's right. So I would encourage you to go to coachwithdoc.com and find out how to be a certified holistic health coach, and then call 855-949-3377 and get your coupon code that's going to save you 50% on that fee. So you go to coachwithdoc.com before midnight tonight and get all your information, find out if it's for you. And if you're watching this or listening to this, it's absolutely for you. Go there, get that information, and then call and get your discount code so that you can save half of the price that it is to become a coach. So instead of paying the normal price at tomorrow, when the pumpkin turns into, at midnight, 12:01, it's going to go back up to full price. And who wants to pay full price when we can pay half price? So make your decision now, folks.
That's right. Thank you so much, AJ. Thank you. Thank you. And that is to become a certified holistic health coach. Folks, if you've ever thought of having your own business, or you have your business and you want to add more to it, something that's going to make a greater impact in your life and the lives of others, I don't know anywhere that you can have a full business with a certification for less than $1,000. Well, you can do it here with us. So folks, get back with the person that shared this program with you. If there's no one to thank, again, give our call team a call at 855-949-3377. We do have almost around the clock coverage now. So I'm super excited to be able to have that and offer it to all of you that are watching this program today. Thank you again, Keeley. You are amazing. You're a blessing to many. We appreciate you, and all of our coaches appreciate you. And folks, all of you that took this time, invested this time into your own well-being. We appreciate you, but you should appreciate yourself more than we appreciate you. Because if you act on this information, your body's going to thank you for many years to come. My name is Becca Dukes. Thank you so much for joining us here on Daily with Doc and Becca. Join us again tomorrow and every day this week as we're bringing more empowering information to help you in creating a better health journey. So until next time, bye for now.
Thank you.
Welcome to Daily with Doc and Becca. This program is for educational purposes only. The statements in this program have not been evaluated by the FDA. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. Testimonials are shared as individual experiences of the individual sharing their testimony. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have the founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach. Welcome to Daily with Doc and Becca. This program is for educational purposes only. The statements in this program have not been evaluated by the FDA. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. Testimonials are shared as individual experiences of the individual sharing their testimony. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have the founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach.